Hey, this is Chris. I'm a student paramedic class 22 at Moreno Valley College, and today we are going to conduct a pre-hospital stroke assessment, and this can rule out or rule in stroke-like symptoms. So the first thing we want to look for with our patient is facial symmetry. So we'll ask our patient to smile real big with their teeth exposed, just like this. And then as our patient's smiling, we want to make sure we see the same number of teeth on both sides, if they have all their teeth. And then if we see any kind of facial asymmetry or drooping on one side, and then absence of wrinkles or difference in the facial nerves, that could be presence of a stroke or indication of a stroke. So the thing we're looking for with that is asymmetry. So that would be a failure point. The second thing would be pronator drift or a sense of proprioception. So we'd ask our patient to close their eyes, hold their palms up, and then if we see rotation inwards with one hand or a drifting down of the arm, that would be indication of a stroke. If they were able to keep them both up, that would be a pass, and that would clear us. The reason you want to have your patients close their eyes and have their palms up is so that their sense of proprioception doesn't allow them to cheat on this part of the test. If they have their palms down, it can be easier for them to know where they are. Another thing we're going to ask our patient to do is grip with both of their hands as tight as they can with our fingers. So we'd go, "Ma'am, can you grab my fingers?" or "Sir, can you grab my fingers with both your hands and squeeze as tight as you can?" With that, we're going to be looking for equal grips. If we have an absence on one side or weakness on one side that isn't already explained, or if our patient has an injury to that side that can be explained, that would be something we'd have to consider. But if it's new onset, that could be presence of a stroke, so that would be a failure. We'd ask them to do the same with their lower extremities. So in that instance, we would have them push against our hands and then pull back with their feet to our hands. So we'd have them push and pull. Inability to do so would result in a failure. Obviously, if your patient doesn't have lower extremities with maybe prosthetics or something, you could modify that. But if they have their extremities and they're able to do so, then you have to do the pushes and pulls just to rule out parts of your stroke scale. And then another thing you're going to be looking for is any kind of slurred speech or aphasia. So you'll ask your patient to repeat a phrase. So, "Sir, ma'am, can you repeat this phrase back to me?" You can't teach an old dog new tricks. So your patient would have to hear that. They would have to convert your saying into meaning within their brain, and then they would have to think about that and repeat the phrase back to you. Inability to do so in any one of those could be a failure point and could lead you towards an indication of stroke. With our stroke scale, we're looking for deficits. So if you have deficits with those, considering our patient is normally able to hear, number one, they don't have hearing aids, or they're not already altered by another source, as in low blood glucose or unconscious from trauma or something like that, then that could be a failure point, or not could be, it would be a failure point in the stroke scale. So if your patient normally isn't altered or normally can understand, normally can read, write, and process, and they're not able to, and they're exhibiting stroke-like symptoms, and they've already failed or might have failed another point within the stroke scale, that could lead you to a stroke. So if you're thinking stroke and the patient fails any point of the stroke scale, you want to tally those points up, and when it reaches a certain amount of points, you have to let your base hospital know, "Hey, our patient is exhibiting these symptoms. they failed X amount of tests, we'd like to take our patient to a stroke center, whether that's primary or comprehensive stroke center. Will have more to do with your assessment, with your other findings, your vitals, the patient's history. So that is the stroke scale. My apologies, I didn't have another person to do this with, but you're basically looking for deficits of the neurological origin that result from a blockage of blood flow or a complete rupture of a blood vessel in the brain, causing the patient to not be able to function properly and think properly.